Hey, physiology peeps. Welcome to the second lecture on endocrine physiology. Okay, so let's share the screen and continue. Last time we talked about what the hypothalamus and pituitary glands secrete. And now we're going to be going gland by gland approach, talking about what that gland produces, what effect it has on the body, and then some disorders. So the pituitary gland secretes growth hormone, among many other hormones. And there's disorder where you don't have enough growth hormone secretion. And usually this occurs in childhood, or at least it's diagnosed in childhood. And what happens is, well, without enough growth hormone, growth is reduced and stature or tallness is reduced. And so I'm showing some little people here. They may or may not have pituitary dwarfism, but it does show that you can have reduced growth. Now, the reason that parents mark their children's height, their growth, on like a door jamb or something, is they're trying to keep track of their growth milestones for their age. And if a child is not meeting their their growth, what they should be at their age, they probably need to go to a pediatrician and make sure that growth hormone levels are normal. Now, the opposite of too little growth hormone and pituitary dwarfism is excess growth hormone secretion from the pituitary. Both of these disorders could occur with a pituitary tumor. So, when there is too much growth hormone, you get excess body growth. For example, this child over here in the upper right is 14. It is probably somewhere between 6 to almost 7 feet tall, and that is way too tall for 14. And so, when the onset of the excess growth hormone happens in childhood, that's called gigantism. And then, when the onset happens in an adult, that's called acromegaly. So when I think of the two, I think of acromegaly and I think of the onset is in adults. I think of the word acromegaly has an A and adult has an A. In fact, let me make this bigger for you. Okay, so I think of the letter A here. All right, and so we're going to underline that. Okay, A goes for adult. Okay. Now, you might think that this is cool, right? That this would be a good thing to have, but it isn't. What the problem is when you have excess growth, you put incredible stress on your joints, especially when you're a growing child and your joints have not matured yet. You could do permanent damage to your joints. And when it's an acromegaly, you pretty much probably have reached your growth milestones. You might get taller, but what seems to happen is the bones thicken. And so, what you see with this woman on the lower right, this is her before the onset, and then the pictures that progress, you see her face has become distorted, and her chin and her brow has become expanded, and that's because there's excess bone put down. And so, that can cause problems as well in joints. Okay, so let's move on to another gland system. Okay, the adrenal glands. So the adrenal glands are glands that sit on top of each kidney, and the gland has an outer cortex. I think of cortex, I think of a capsule that wraps around something, and the inside's called the medulla. So the adrenal cortex, it will respond to pituitary ACTH, and it can make several things. One of the things it can make is tiny amounts of sex steroids like estrogen and testosterone. The other thing that the adrenal gland can make is aldosterone. But to be fair, the aldosterone production is really stimulated by a hormone from the hypothalamus. Okay. But this hormone, aldosterone, is called a mineral corticoid. Minerals are salts, and aldosterone is going to affect salt reabsorption in the kidney tubules. So I've put in red the letters ALST, and if you rearrange those words, it spells salt. Okay, so aldosterone causes your body to retain salt. If you retain salt, that means it's being pulled across the kidney tubules and put back into circulation. What do you think follows salt around like a puppy? Water. Water will leave your kidney tubules following salt, and water will enter your bloodstream as well. So, aldosterone ends up making you retain salt, which makes you retain water. Okay, and then the most important hormone that ACTH from the pituitary causes to be secreted is cortisol. So, cortisol is your body's stress hormone. It's also your body's natural anti inflammatory, and it's called a glucocorticoid because, well, it's going to affect glucose in your bloodstream. Okay. Cortisol, the stress hormone, when your body's stressed, like you're studying for an exam, your body responds by mobilizing glucose into the bloodstream because your body feels like it needs energy because it's stressed. Your body will also mobilize fat or lipid stores into the bloodstream as another resource for the body when it's stressed. So, cortisol can raise blood glucose and raise your blood fat levels. Okay, so speaking of cortisol and its function as a stress hormone and as a body's natural anti inflammatory, we have synthetic glucocorticoids that you are prescribed when you've got inflammation somewhere in your body, like you've got a rash that won't go away, or maybe you've got irritable bowel syndrome or Crohn's disease or some other chronic inflammation. You can be prescribed glucocorticoids. Ha! But that's going to affect the negative feedback system with cortisol. So let's look at that clinical app. So, glucocorticoids, like the topical hydrocortisone you can put on your skin, can suppress inflammation, but they can also slow healing. Okay, now the glucocorticoids like prednisone, dexamethasone, prednisolone, all those alones, um, they are given to decrease inflammation. Sometimes they're given to suppress the immune system, but most of the time they're given for anti inflammatory effects. Now, synthetic levels of glucocorticoids from this medicine you're taking make the synthetic glucocorticoids rise in your bloodstream. Your hypothalamus thinks that's cortisol, and it thinks, cortisol levels are pretty high. I better start bringing it down. So, what the hypothalamus does is it stops secreting CRH, and that makes the pituitary stop secreting ACTH. And without ACTH, your own adrenal glands, the cortex, will stop producing its own natural cortisol. Okay? Now, when you come off of prednisone or those other anti inflammatories, you're supposed to gradually wean yourself off of it with lower and lower doses before you stop. You don't want to stop cold turkey because while you're on those drugs, your adrenal gland, without being stimulated, will atrophy. And so, as you wean yourself off the prednisone, you're giving your adrenal cortex time to start producing it again because as you take less and less of it, the hypothalamus inhibition of CRH and the pituitary inhibition of ACTH will be lessened. They will start producing those hormones again, and your adrenal cortex will come back online. Okay, negative feedback. So, back to the PowerPoint. Okay, now the adrenal medulla also produces a hormone, a very important one. When you have a fight, flight, or sympathetic response, your hypothalamus stimulates your adrenal medulla, the inner part, to pump out that epinephrine. So if you've ever had a fight, flight response, we all have, you get that flush of adrenaline. Well, that adrenaline's coming from your adrenal glands. Okay, so we were talking about cortisol. Let's talk about a disorder of cortisol. Let's talk about Cushing's disease or Cushing's syndrome. So, Cushing, I underline the C, and I also underline the C in cortisol. Cushing's disease is excess cortisol secretion by the adrenal cortex. And there's a clinical app online for that. But what happens, it could be a problem in your hypothalamus, or it could be a problem in your pituitary. It could also be an adrenal gland tumor. And so remember that cortisol can increase your blood glucose and blood fat levels because it's a stress response. So what you'll see is hyperglycemia, high blood glucose. You'll also see hyperlipidemia, and that is a rise in your blood triglycerides and fatty acids. What you will also see is high blood volume. What happens with Cushing's is you tend to retain water in your face and in your body. People will develop what's called a moon face. So this boy up here on the upper right, here is him before Cushing's, here is he after Cushing's. All right. Now, if you have high blood volume because you're retaining water, that will cause you to have high blood pressure or hypertension. These are all landmark signs of Cushing's disease, as well as having high blood cortisol. Okay, How about a disorder of aldosterone? Addison's. Okay, so here's the A in Addison's and the A in aldosterone. So Addison's is low aldosterone. It does affect cortisol to some extent, but I'm going to have you focus on the aldosterone being low. Now, if you remember, I said aldosterone has the letters A, L, and S and T. And if you rearrange that, that spells salt. So if you don't have enough aldosterone, you're not going to retain salt from your kidneys. Less salt's going to go back into your bloodstream. You're going to end up peeing that salt out. And if you're not retaining salt, that means you're not retaining water. The water is going to be following the salt out in your urine. And so what's going to happen is you're going to be dehydrated. Okay, so you're losing salt and water out in your urine. So what happens is the presentation is low blood sodium because you're losing it. And that's called hyponatremia. And the Na here, I've underlined, is the symbol for sodium. Okay, you'll also have high blood potassium or hyperkalemia. So the K in kalemia stands for the symbol for potassium, which is K. Now here's something about sodium and potassium. Wherever sodium's going, potassium's usually going in the opposite direction. So if you pee out or lose sodium, you're going to end up retaining potassium. If you lose potassium, you're going to end up retaining sodium. So in this case, you're gaining potassium. Now, hypovolemia, you have low blood volume. Oh, that's a mistake. Let me fix that here. Let me go and back to this one. Back. Sorry about all this. Okay, we went too far. Okay, here we go. We have, yeah, I think I fixed it here. Low blood volume. Yeah, I don't know why it looked wrong to me, but hold on here. Yeah. Oh, that's what's wrong. Escaping. You're losing. You're losing body water. Okay, we had to fix that little typo. Okay. So what's happening is you're losing body water because you're peeing it out. Okay? If you have low blood volume, your blood pressure is going to be low. Now, you'll also have anorexia, and that's not a true loss of body um, mass. What it is, it's a loss of body water. Anytime someone loses weight very quickly, like within a week or two, that's usually a loss of body water. And you'll also have too little cortisol, okay? So it's low aldosterone and some low cortisol. So without that cortisol, your blood glucose can drop. Okay, so let's move on to the next slide. Oh, I forgot skin bronzing as well. So, something about insufficient aldosterone overstimulates your skin's melanocytes and they put down a lot of pigment. And so you get skin bronzing. Now, this is low aldosterone. What happens if you have Conn syndrome or you have too much aldosterone? It's known as hyperaldosteronism. So, what you'll see is a problem relating to you're retaining too much salt, you're retaining too much water. So, what you'll have is hypernatremia, too much sodium in your blood. Then, if you're retaining sodium, you're going to be losing potassium out in your urine. So, you'll have hypokalemia or low blood potassium. What you'll have since you're retaining salt, you will retain body water, and that's called hypervolemia. And if your blood volume goes up, your blood pressure will go up, so you'll have hypertension as well. And because you're retaining water, you'll have weight gain. Okay, here's another adrenal gland disorder, pheochromocytoma, where you have excess epinephrine from the adrenal gland. So you'll have the signs of being on full fight or flight 24/7. So imagine if you're on a full fight flight, your heart rate will be skyrocketing. You'll have tachycardia. You will have high blood pressure because of the high heart rate. You'll be hyperventilating, breathing really fast, panting. You will also have high blood glucose because when your body's stressed, as in fight flight, your body releases lots of cortisol as a resource. You'll also have high blood lipids for the same reason. Your body mobilizes all of its resources because your body feels like, you're in fight flight. And because your heart rate is racing, you're panting, you'll also be nervous and sweaty and anxious. So trust me, you don't want to see this disorder. Okay, moving on to the thyroid gland. So the thyroid gland is located on the anterior of the trachea, and on the posterior of the trachea, these green lumps right here are called parathyroid hormones. But let's talk about the thyroid gland first. The thyroid gland produces T3 and T4, okay? Triiodothyronine and thyroxine. Thyroid hormones are so important that they're included in most routine blood panels. Now, what your thyroid hormones do is they regulate your body's metabolism. So, if you have a lot of thyroid hormones circulating, your metabolism is going to be high. If you have low thyroid hormones circulating, your metabolism is going to be low. The thyroid gland also produces calcitonin, which will drop your blood calcium levels. So, the parathyroid glands, located on the opposite side of the trachea, kind of do the opposite of what calcitonin does. It produces parathyroid hormone that increase your blood calcium. But let's talk about some thyroid gland disorders because they are so common. We'll start with hyperthyroidism, excess thyroid hormones, excess T3 or T4, or both. Now, that could be caused by a thyroid gland tumor. It could be a problem with the hypothalamus. It could be a problem with the pituitary gland. It could also be an autoimmune attack where your antibodies stimulate the thyroid receptors excessively. And that autoimmune attack is called Graves' disease. So there's two things that can happen. The thyroid hormones can be high, or your immune system has antibodies that are attacking and stimulating the thyroid gland receptor directly. Either of these scenarios causes hyperthyroidism. So, the clinical presentation is you're going to be jacked up. Your metabolism is going to be very high. You're going to be hot because your body, is operating at high metabolic rate. That could lead to tachycardia and high blood pressure and sweating because your body is metabolism is so high. Another thing that you'll see is fluid retention behind the eyes, and that causes the eyeballs to protrude out from the eye sockets, and that's called exophthalmos or bulging eyes. Okay, now with Graves' disease, you might see someone present with an enlarged thyroid gland called a goiter. Now, what's happening with a goiter is the immune attack is overstimulating the thyroid gland receptors. And what the thyroid gland does in response, since it's being overstimulated, it grows. Okay, it becomes larger. Okay, so that's one thyroid gland disorder. And hyperthyroidism is more common among males than females. Females are more commonly diagnosed with hypothyroidism or insufficient thyroid hormones. Now, it could be caused again by a tumor, um, a goiter, or insufficient dietary iodine. You need iodine to make the hormones T3 and T4. Now, in the United States, we don't usually see dietary iodine deficiencies because you buy salt at the store that's iodized. Table salt is iodized salt where iodine has been added. But if you ever travel with Doctors Without Borders and go to other countries where salt isn't iodized, you might encounter this. So, what you will see is the opposite of hyperthyroidism. You'll see a low metabolism and depression, lethargy, intolerance to cold because your metabolism is so low. You might have dry skin. And you also might have an enlarged thyroid gland, and I'll explain that in a second. When hypothyroidism occurs in childhood, with that reduced metabolism, you'll have reduced growth, and that's called cretinism because you also need thyroid gland hormones for normal growth. Okay, so how is it that someone who has hyperthyroidism, like Graves' disease, and hypothyroidism both could present with a goiter or an enlarged thyroid gland? Well, in the case of Graves' disease, up here, it's because antibodies are overstimulating the thyroid gland and it responds by proliferating or growing. When you have hypothyroidism, here's what's going on. So, the normal pathway for thyroid gland production is the hypothalamus secretes TRH. That makes the pituitary secrete TSH. TSH stimulates the thyroid gland to make T3 and T4. Okay, and then if there's too much, the pathway is inhibited. Now, in someone who has, uh, let's say, hypothyroidism, let's say they have dietary iodine insufficiency, okay, and they simply cannot make enough thyroid hormone, what happens is the hypothalamus says, uh-oh, thyroid hormones are too low, so I'm going to stimulate it to get more. So I'm going to release more TRH. That makes the pituitary secrete more TSH, which stimulates the thyroid gland more. And the thyroid gland says, hey, I just can't make enough of these thyroid hormones. I'm sorry, I can't help you. But because TSH is stimulating the thyroid gland, it grows, it thickens, it proliferates, but you're still not getting the thyroid hormones that you need. So basically, the stimulatory pathway just keeps going and you can get a goiter. All right. All right. And let's talk about the gonads. And we'll take a break after this one. This will be the end of the second lecture. The gonads, ovaries or testes. The testes will respond to pituitary LH by making testosterone. The testes will respond to pituitary FSH by maturing sperm. And of course, this happens at sexual maturity, puberty. In the ovaries respond to LH by making estrogen, and it causes ovulation of a mature egg. Okay, and that would be happening at puberty for a woman. The ovary responds to FSH by I'll get back to that, by maturing an egg each month. Okay, so LH causes the ovary to make estrogen and eventually progesterone, and it causes monthly ovulation of a mature egg. Okay, so here we have in an ovary a follicle, the little white thing, and then inside the little blue thing is the egg. And every month, one egg matures under the influence of FSH, and the egg goes through meiosis. The follicle that houses it fills with fluid. And then when that egg is ready to be mature, there's so much fluid in that follicle that it actually has tremendous pressure, and the follicle erupts open. And it actually rips a hole in the ovary wall, and the little egg goes poof to a fallopian tube. Okay, so that's the effect of those pituitary hormones on the ovary. Okay, so this is a great place to take a break, and I'll pick up with lecture 3 later on. Okay.